Hi everyone. Uh, my dad this morning was taken by police to Armadale Hospital because he refused to take his last depot injection. He's diagnosed with schizophrenia, um, and but these medications haven't doing him any good. They haven't solved anything, and yeah, so he refused to take his depot injection, and one of the medical team came and assessed him a couple of days ago, and yeah, because he's on a community treatment order, they called the police to come and take him this morning against his will. I'm very thankful that the police did a good job, and because I did tell them I don't want him to be harmed in any way, and I want his dignity and honor to be taken care of. And so, yeah, the police did an excellent job. I'm thankful for that. However, I'm not happy with the mental health system in this country. And I did make a video before that about just like general science about how mental illness meds are working and all that. And now I have written a letter to the mental health team there to to do a better job, and I'm going to read this letter. I hope it results in something good. And yeah, so the letter starts with dear psychiatry team. Regarding urgent review and reconsideration of Amir's medication regimen. We, Amir's family, are writing to express our deep concern and alarm about the long-term effects of the medications Amir has been taking for his schizophrenia diagnosis. As you are aware, Amir has been on depot injections for over 20 years, and we strongly believe that the risks and side effects of these medications have not only outweighed the benefits but are now causing irreparable harm to his physical and mental health. We respectfully, yet firmly, request an immediate review of his medication regimen and a strong consideration for cessation of these medications. As individuals with a strong scientific background, we have extensively researched the pharmacology and neuroscience underlying Amir's medications. We understand that the general mechanism of most mental illness medications, including antipsychotics and antidepressants, is to modulate neurotransmitter activity, which ultimately slows down brain function. And there is a reference down there. This slowing down of brain function has a profound impact on the body's physiological processes, leading to a cascade of adverse effects, including decreased cardiac output, reduced respiratory rate, and impaired renal function. Another reference. The scientific medications Amir is specific medications Amir is taking, including cariprazine, risperidone, and duloxetine, have been linked to an increased risk of cardiovascular events, metabolic syndrome, and respiratory failure. There are 3 references down there. The combination of these medications may be contributing to Amir's rapid decline in physical health, including his recent hospital admissions for respiratory failure, heart failure, the right side, high obesity, muscle dystrophy, and fluid retention. Statistical studies have shown that long-term antipsychotic use is associated with a significant increase in mortality rates, particularly in older adults. 2 references. A study published in the Journal of Clinical Physiopharmacology found that the risk of death from cardiovascular disease was increased by 31% in patients taking antipsychotics for more than 10 years. And there is a reference. Another study published in the British Medical Journal found that the use of antipsychotics in older adults was associated with a 45% increased risk of stroke and a 50% increased risk of transient ischemic attack, and there is a reference. Furthermore, the polypharmacy that Amir is currently experiencing with multiple medications interacting and exacerbating each other's side effects is a recipe for disaster. We are concerned about the cumulative effect of these medications on Amir's overall health and urge you to take immediate action to review and reconsider his medication regimen. We request that the following actions be taken. Conduct a thorough review of Amir's medication regimen, taking into account the potential interactions and cumulative effects of the medications. Consider the long-term side effects of these medications, particularly in the context of Amir's age and physical health conditions. Discuss the potential benefits and risks of tapering or ceasing these medications with a view to improving Amir's overall health and well-being. Explore alternative treatment options such as therapy and lifestyle modifications to support Amir's mental health. Close monitoring of Amir's physical health to address any underlying issues, conditions, and prevent further decline. We emphasize that time is of essence as Amir's health continues to deteriorate rapidly. We request a prompt response and resolution to this matter, as we fear that the further delay may result in irreparable harm to Amir's health. And sincerely, so Amir, my dad is 70 years old, or 71. I think it's 70, and his body is completely shutting down. He's dying, and these mental illness medications are doing nothing. They haven't helped him at all. And sadly, I had to go and do my own research. I'm not a pharmacist. I'm not a biologist. I'm not a chemist. But there is research out there, and I did my research, and I know how these medications are harming him. And sadly, again, my family, most of them, are even though some of them are they are pharmacists and nurses and blah blah blah, and chemistry PhDs and all that, but they weren't believing me, and they aren't believing me. So now that I've done this research, I am going to we are going to sit together and hopefully come up with a finalization of this letter. And yeah, something needs to be done, because my dad has been admitted to hospital many times over the last couple of years, many times, over 7 times or something more. And every time he goes in there is no review of his medications. They just keep giving him the same shit, and that's no good. So yeah.